Most parents imagine autism assessments completely wrong. They imagine their child sitting in a room, being interrogated, judged, or forced through uncomfortable testing. But honestly, that's not how I approach assessments at all. In my practice, most families come in because life at home has become quietly very hard. The mornings are difficult, transitions are difficult, school may be difficult, meltdowns may happen every single day. And parents usually tell me the same thing. We feel like something is off, but we don't fully understand what's happening. So in this video, I want to walk you through what actually happens during an autism assessment for a child, what I'm looking for clinically, and how the process works from start to finish. One of the biggest reasons parents seek assessment is meltdowns. And when I say meltdowns, I don't just mean occasional frustration. Sometimes the entire household starts revolving around preventing the next meltdown. For some families, the struggle starts the moment the child wakes up. They may not want to get out of bed. A sibling says something small and suddenly there is conflict. A transition happens from bedroom to breakfast table, from breakfast to getting dressed, and everything becomes stressful. Sometimes the child forgets homework or loses an item right before school, and the entire morning explodes into panic, crying, yelling, or shutdown. And over time, this affects the whole family. Another major issue I see is anxiety. Some children become extremely anxious around transitions, school, performance, or separation from parents. A child may refuse to sleep alone. Parents may spend hours trying to settle them at night. Some children refuse school completely because school itself has become emotionally overwhelming. Sometimes they are struggling socially. Sometimes they're masking all day at school and collapsing emotionally once they get home. And many children become very hard on themselves. They worry about grades, sports, making mistakes, disappointing people, fitting in socially. Over time, anxiety, rigidity, emotional dysregulation, and social struggles all starts feeding into each other. Sometimes the child becomes the target of bullying. Other times the child becomes aggressive during stressful situations because they're overwhelmed and unable to regulate. And this is usually the point where parents realize we need clarity. We need to understand what's actually happening. And this is important. An autism assessment is not just about giving a label. It's about understanding how your child thinks, communicates, regulates emotions, and experiences the world. Once families decide to proceed, the first step is intake. Families complete detailed forms through our secure portal so I can understand what challenges are happening, when they started, how the child functions at home and school, what concerns the parents have most. Then we move on to the next parent interview. A lot of the time we do this over Zoom. Sometimes both parents attend, which is often very helpful because each parent notices different things. This part is extremely important because parents give me very rich real-life information. For example, if aggression is a concern, I want to understand what triggers it, what situations it happens in, how severe it becomes, what happens before and after. And honestly, this is also where I begin building trust and rapport with the family because many parents are anxious before assessments too. After that, we move into questionnaires. These are evidence-based questionnaires designed specifically for children. Some of the common ones I use include Social Communication Questionnaire, the SRS, Vanderbilt questionnaires for ADHD symptoms, and depending on child's age and presentation, I may also send forms to teachers. That part is very important because children often present very differently at school compared to home. Some children hold everything together at school and completely fall apart at home afterward. Others struggle more visibly in both settings, and understanding both environments help me make a much more accurate assessment. Now, here is the part parents are often surprised by the most. The assessment itself is usually much more natural and observational than they expect. Observation is honestly one of my favorite parts of the process, and when I say observation, I truly mean observation. I am not trying to interrogate the child. Some families drive hours to come see me here in Ottawa, so my goal is not to overwhelm the child. My goal is to reduce anxiety quickly and create an environment where the child feels comfortable enough for me to see authentic behavior. And I actually begin observing before the child even enters the office. I observe from the hallway, from the elevator, from the waiting room. That already gives me valuable information. I am looking at facial expressions, comfort with transitions, reactions to environment, body language, eye contact, communication style. Then, during the assessment itself, we use conversation, games, puzzles, and problem-solving tasks. And this gives me a lot of clinical information. For example, are they rushing impulsively through tasks? Are they missing details? Are they becoming rigid with rules? Are they struggling with flexibility? Are they getting frustrated quickly? Can they regulate themselves when things become difficult? Sometimes children with ADHD rush through tasks impulsively. Sometimes children with autism become extremely rule-focused or rigid during activities. And sometimes anxiety is driving the entire presentation. Part of my role is differentiating those patterns carefully. I'm also observing social reciprocity, back and forth conversation, fidgeting, sensory behaviors, subtle mannerisms, speech cadence, emotional regulation. And often very subtle patterns tell me a lot. And once all the information comes together, that's when the assessment becomes truly valuable for families. After the assessment, I review all the information: parent interview, questionnaires, school input, observation findings, developmental history. Then I prepare a detailed report. That report may include diagnostic clarification, school recommendations, accommodation recommendations, IEP support recommendations, treatment recommendations. If a child qualifies for autism diagnosis, I may also provide documentation families can use to apply for programs like OAP. Some families also want help understanding treatment options. And depending on child's needs, I may recommend occupational therapy, speech language pathology, behavioral therapy, emotional regulation support, ADHD medication consultation. Some children may benefit significantly from medication. Others may benefit more from therapy, school supports, sensory work, or structure at home. Every child is different, but the biggest thing families usually gain from assessment is clarity, because many children themselves are confused too. They know they are struggling, They know certain things feel harder for them, but they don't fully understand why. And often, once families finally understand what's happening, things begin making much more sense. So, if you have been wondering whether your child should be assessed, my advice is usually this. Clarity is almost always better than years of uncertainty. And the earlier families properly understand what's happening, the earlier they can start building the right supports for their child. If you would like to learn more about assessments at Crocus Care, you can visit our website below, crocuscare.ca. And if this video was helpful, feel free to subscribe because I'll be making more videos about ADHD, autism, anxiety, emotional dysregulation, and child mental health.